Hi students, welcome to general pathology sessions. In this video we are going to discuss about a short topic that is usually asked as an university, a short essay type of question, that is your chronic inflammation. So what is about chronic inflammation? What happens in chronic inflammation? As the name indicates, it is chronic. What do you mean by chronicity? Means the onset or duration of this lesion is for a longer period of time. Okay, the duration or the time of onset is for a longer period of time, that is chronic inflammation. So it is actually a low grade inflammation. It is not like your acute inflammation. This is a low grade inflammation, so that the manifestations will be in a normal way or in a low grade way. Okay, so it is a low grade inflammation, and usually the manifestations are asymptomatic, means the patient will not show any much symptoms, just like in acute inflammation. So in acute inflammation the patient may be showing some symptoms like your pain, edema, okay, loss of function. All these symptoms will be shown by acute inflammation, but such kind of symptoms are not shown in chronic inflammation. So we say it is clinically asymptomatic, and it is of a longer duration of time. It can persist for a longer duration of time in the body. So it is a prolonged process, means that once you get this infection, if you're having a chronic infection in your body, it will be remaining inside the body for a longer period of time, and it can cause your tissue destruction and inflammation that occurring at the same time, and it is prolonged. It is happening for a longer period of time. So that is the peculiarity of a chronic inflammation. Now what are the three causes for this chronic inflammation? First one is the chronic inflammation following an acute inflammation. So an acute inflammation, when you treat the acute inflammation, the inflammation will subside and it will go into a chronic state. Okay, so after an acute inflammation, when we are giving antibiotics, or when you are treating the acute inflammation, the acute inflammation will subside. It may subside to a level that it is not completely gone, but the acuteness is gone, and now it will persist in a chronic way or a symptomatic way. Or you can see in recurrent attacks of acute inflammation. After recurrent attacks of acute inflammation, our body will adapt to that acute inflammation, and it can persist in our body as a chronic inflammation, because after recurrent acute inflammations, the lesion will be kept as a chronic inflammation by our body, because our defense cells will be capable of attacking this or preventing this acute inflammation. But still the organism is there in our body, still the causative organism is in our body, and it will remain in a chronic stage. And other thing is that the chronic inflammation starts by its own. By de novo means it is starting by its own in a fresh individual, in a fresh state. Okay, so imagine you don't have any inflammation in your body. A chronic inflammation can start occurring in your body without any previous history of any other inflammation. A chronic inflammation can occur. So these are the three causes. So let's see the first one, the chronic inflammation following an acute inflammation. Okay, so here we had an acute inflammation at the beginning. So we have an extensive tissue destruction at the beginning, and we are trying to treat this patient. And but because of our treatment, the acuteness is reduced, but still some amount of the bacteria will survive in the destroyed tissue. So we have an extensive tissue destruction, but little amount of this bacteria may survive in the site. Okay, because of the improper treatment or not completing the complete course of the treatment, some amount of bacteria may survive, and it can result into a chronic inflammation which will persist. Example is your osteomyelitis. See, in osteomyelitis means the inflammation of your bone. Okay, we have an acute osteomyelitis and we are treating, and we are not treating it properly. Some kind of the fact, some amount of the bacteria will remain dormant or remain inside the bone, where your antibiotics cannot reach, or you are not properly debriding that area. So in osteomyelitis it can transform to a chronic inflammation, or it can in a pneumonia, in a lung abscess. In a lung abscess, if some of the organisms are remaining as a chronic stage, it can lead to chronic pneumonias. Now coming to the next reason, the recurrent attack of acute inflammation. I have told you the acute inflammation is coming again and again and again, and it will retain in the body as a chronic inflammation. For example, you have your urinary tract infection. Okay, the urinary tract infection, you are getting more urinary tract infection again and again. It can lead to your pyelonephritis. Okay, inflammation in the kidney, chronic inflammation in the kidney. Now coming to the third cause, the chronic inflammation starting de novo, means in a previously unexposed individual, in a previously normal individual, a chronic inflammation is occurring. So an example of chronic inflammation is your TB. Okay, TB is a chronic inflammation. Now there is nothing called the person having acute TBs and then making a chronic TB. No, TB itself is a chronic inflammation. So TB can occur in a fresh individual where he doesn't have any history of TB. Okay, there is a person who doesn't have any of the inflammation, but if he come in contact with the TB bacilli, or if he come in contact with a person with the TB, he can also develop a tuberculosis infection. So it is mainly caused by an infective agent which is of low toxicity, means that cannot make an acute inflammation in his body. The bacilli itself, the tuberculosis bacilli cannot make an acute inflammation on his body, but the bacilli can remain dormant in his body and it can make small chronic inflammations. Okay, and that is due to delayed hypersensitivity, and such kind of chronic inflammations are usually the inflammation related to our granuloma formation, your granulomatous infections. Okay, so your granulomatous infection like your TB, okay, your leprosy, okay, those cases they are forming granulomas. This granuloma is nothing but our body's resistance to this organism. So when the organism comes to our body will make a granuloma around it. This granuloma is formed by your inflammatory cells, your histiocytes, your macrophages, okay, your Langerhans giant cells. All these cells will come around it and it will seal off this organism by forming a granuloma. So in this kind of inflammations, they are chronic inflammations. Okay, they can't make any acute inflammation there, so they are chronic inflammation. Now coming to type of chronic inflammation, there are specific chronic inflammations which they only make chronic inflammation, that is your granulomatous lesions. See, your granulomatous lesions are specifically chronic. These bacteria cannot make an acute inflammation in our body. Okay, they are low virulent. We say low virulent organism, means they are not that serious to make an acute inflammation in the body. Okay, not like your streptococcus bacteria or your staphylococcus bacteria or your clostridium bacteria which can make acute inflammation. These mycobacterium or your mycobacterium leprae bacilli, all these are chronic bacteria, so they make chronic inflammation, granulomatous inflammation. Okay, now they are specific. Okay, they are very specific. Now there is another called chronic non-specific inflammation, means chronic osteomyelitis. It is not due to a specific bacteria. Osteomyelitis is just an inflammation of your bone, or infection of your bone. This infection can be caused by any causes. Okay, they can be caused by a fungus, a bacteria, okay, anything, or it can osteomyelitis can also occur due to a reduced blood supply to the bone. It can also occur due to any bone pathology. Okay, due to bone pathology, due to any tumor or any pathology, any developmental disorder of the bone. Okay, any fibrosis lesion, or due to any cause it can develop into an osteomyelitis. Also in the lung abscess, in the lungs, an abscess can be due to any cause. Okay, many causes they can cause a lung abscess. Now there is specifically the chronic granulomatous inflammation, means the inflammations which make granulomas. Example is your TB, your actinomycosis, your sarcoidosis. Okay, all these cases there is a granuloma formation. In sarcoidosis, there is no causative organism. Okay, there is no specific organism, but it is a granulomatous lesion. Okay, so all these are your chronic inflammation. Now coming to general features of a chronic inflammation, what you see in a chronic inflammation? In a chronic inflammation, you are seeing mononuclear cell infiltration. Means that there is no polymorphonuclear infiltration, means there is mostly the infiltration is by cells with a single nucleus. In acute inflammation, what you see lot of infiltration of your PMNs, polymorphonuclear your WBCs, that is nothing but your neutrophils. They are seen in your acute inflammation. Okay, in acute inflammation, you are seeing PMNs, polymorphonuclear leukocytes. Okay, here in mononuclear infiltration, what you see, what are the mononuclear cells? Your monocytes, your lymphocytes. Mostly you see the cells with a single nucleus. Okay, now there is tissue destruction or necrosis can be seen, and there is another thing called proliferative changes which is not seen in your acute inflammation. In acute inflammation, this is not seen in acute. What you mean by this proliferative changes is that these monocytes or the macrophages or lymphocytes can stimulate other cells to proliferate to seal off this inflammation. Okay, they can stimulate your fibroblast, they can stimulate your histiocytes, they can stimulate other macrophages. Okay, they can stimulate other cells, so that that will stimulate a proliferation of this cell. And what is the byproduct? They make granulomas. So granuloma is nothing but a defensive mechanism of our body towards a chronic inflammation. Okay, now coming to the mononuclear cell infiltrate. What are the mononuclear cell infiltrates? It is infiltrated by mononuclear inflammatory cells. They are phagocytic cells or the lymphoid cells. Okay, what are the phagocytic cells? I have told you phagocytic cells and the lymphoid cells. The phagocytic cells are nothing but your monocytes, your macrophages, okay, your epithelioid cells and your histiocytes. Okay, histiocytes and your multinucleated giant cells, that is nothing but your Langhans giant cells. Okay, example is your Langhans giant cells. So these populations of cells are seen, but in acute inflammation, what are the cells you can see? You are seeing neutrophils, eosinophils, you are seeing a lot of lymphocytes. Okay, but in chronic inflammation, you are not seeing any neutrophils. Here you are seeing more amount of phagocytes, your macrophages, monocytes, and your lymphocytes. Okay, and you are seeing multinucleated giant cell, and you are seeing histiocytes or epithelioid cells. You are seeing proliferating epithelial cells or epithelioid cells, that is your histiocytes. Okay, now let's see what how this mononuclear cells come in a granulation in a chronic inflammation. Okay, the macrophages. Okay, when there is a chronic inflammation, the macrophages are activated. Why it is activated? It is activated through the slow activation of your bacterial toxins. Okay, the bacterial toxins and the lymphokines, they are chemical mediators produced by the bacteria. So there is a bacteria in our body. The bacteria is making some kind of chemicals, and these chemicals will activate the macrophages. These macrophages, how they are formed? In the bone marrow, every cell makes made in the every hematopoietic cells are made in the bone marrow. In the bone marrow, we have a hematopoietic stem cells which give rise to all the cells in the bone marrow, and they make the monoblast cells, and monoblast cells are present in the monocytes as monocytes in the blood. Now whenever there is an infection or inflammation, whatever it is, this monoblast cell will transfer to the tissue from the blood. It is going to the tissues. Okay, so the monocyte in the tissues in the blood will go to the tissues, and they make a tissue macrophage. Okay, the defense cells in the tissue, they're called tissue macrophages. So what this tissue macrophages do? What is the function of this tissue macrophages? On activation of this macrophages, I have told you that these macrophages get activated by the bacterial cytokines or bacterial endotoxins. They get activated. These macrophages are getting activated. Now what they do, once they activate, they release some proteases. They release their acid as well as neutral proteases. What is the function of this protein? They digest proteins. Okay, they destroy the proteins, mainly your collagen. Okay, all these are destruction is done. They also produce free radicals, oxygen related reactive metabolites, your free radicals. Also, they make cytokines. They release other cytokines or chemical mediators. Okay. Now, what all these things do? They will do. They will cause tissue destruction. This protease will and your oxygen free radicals as well as cytokines. They cause tissue destruction. Also, what happens, they can stimulate the other cells here, they can stimulate other cells, and they can cause neovascularization, new blood vessel formation and fibrosis in that area. Okay, now see, in this image we have a T lymphocyte here. This T lymphocyte is a mononuclear cell, right? There is only one nucleus, mononuclear cell. They get activated T lymphocyte, and they secrete certain cytokines, your TNF alpha, tumor necrotizing factor, alpha, and other inflammatory mediators that can cause inflammation. And this interferon gamma, IFN gamma, is called interferon gamma. They will act on the macrophage. They activate the macrophage. They are activating the macrophage. This activated macrophage can cause other inflammation. They can secrete other TNF mediators. Okay, so these are the two mononuclear cells that is acting in the chronic inflammation, your lymphocytes as well as your macrophage. So they are the one releasing all these cytokine factors. Okay, and what they do, there is necrosis. Okay, necrosis. In necrosis we are seeing is seen in the chronic inflammation. So what type of necrosis? What type of necrosis you usually see in your granulomatous, or we say chronic inflammation? What type of necrosis? Can you say, in the video of necrosis, in the previous lecture on the necrosis, I have told you about 5 type of necrosis, out of which one is related to your TB? Okay, which one is related to your TB? Your caseous necrosis. Caseous necrosis. Okay, so there is a necrosis in chronic inflammation, which is the most common in chronic inflammation, your caseous necrosis, and it is caused by your macrophages. By why they release certain enzymes. These macrophages release enzymes which will destroy your proteins. So what are the enzymes? They release proteases. I have told you they release acid and neutral proteases. So the protease, elastase, collagenase, lipase. Okay, so protease destroy protein, elastase destroy your elastin protein, collagenase they destroy your collagen, lipase they destroy the lipid component, and your reactive oxygen species, nitric oxides, all that will destroy and cause necrosis. Now what next? The proliferative changes. What are the proliferative changes? The cytokines from the macrophages, activated monocytes or the macrophages, they will stimulate other cells like your fibroblast. They will stimulate the blood vessels, endothelial cells. So there is neovascularization and fibrosis. So there is a formation of your granulation tissue. In the granulation tissue, there is vascularization that is brought about by this small blood vessel, proliferating blood vessels, and fibroblasts, they cause fibrosis. Okay, so that's what happened in your chronic inflammation. Now what are the other systemic conditions you can see in a person with a chronic inflammation? So that's all about your chronic inflammation. And what else you can see in a chronic inflammation? A person with a TB. Can you imagine that a person is having a TB? Okay, he is having a chronic inflammation. What you can expect in him? He may be having a fever. Okay, he have fever, a weight loss and weakness. Okay, in a TB patient, you can see, you imagine a TB patient. A TB patient, he is having fever, cough and all, and he will be having extensive weight loss in the past years. Okay, if you ask the patient, he will be very lean. If you ask him, he may say that I was very very built and I got this much lean. There is a weight loss, severe weight loss, and he may feel weak. He may feel anemia. He may develop anemia because of this wasting, and he may feel leukocytosis. He may get leukocytosis. Okay, because of the persistent chronic inflammation in the body, our leukocytes will be produced more and more. Okay, leukocytosis will be produced. There is an elevated ESR rates, and I have told you in a lecture of our amyloidosis, I have told you secondary amyloidosis. Why a secondary amyloidosis occur? Due to chronic inflammation or chronic infection can lead to secondary amyloidosis. So you can develop to a secondary amyloidosis. The patient will also show secondary amyloidosis. So this is the sequelae of your chronic inflammation. These are the things you see in chronic inflammation. Okay, hope you understood the class. See you in the next class with another video. Thank you.